Okay, oral minoxidil, let's go over it. What are the side effects? What are the pros and cons for it for hair loss? First off, oral minoxidil has been around for a very long time. They first used it in the 70s. They started doing clinical trials on it for blood pressure, for lowering blood pressure. And an unexpected side effect was hair growth. People noticed, hey, my hair's getting better. And that's what spurred the topical minoxidil craze. And 50 years later, we're going back to oral minoxidil. Now, when you start using oral minoxidil, the same issues come up as topical minoxidil, meaning you'll get a temporary shedding of your hairs, which will improve with time. It's not a miracle worker, but the hairs you have will get thicker. Some hairs will show up, but the problem is once you stop using it, all the results will go away. Now, in addition to those issues, there are some special considerations for using oral minoxidil. Now, it is a blood pressure lowering medication. It's not very good at it, but there are still risks of symptoms and side effects from your blood pressure being lowered, especially if you have low to normal blood pressure. Those symptoms could be dizziness, lightheadedness, headaches, nausea. Another big thing is minoxidil can increase or change blood flow and can cause swelling. So you can get leg swelling. Some people even notice facial edema, periorbital edema, facial swelling, and very rarely you can get fluid buildup around the heart, also known as pericardial effusion. Now, because your blood pressure is getting lower or it's somehow affecting your overall fluid levels, it can also increase your heart rate. So some people notice palpitations or arrhythmias. If your heart rate's beating too fast and you have other health problems, that could also lead to more significant issues such as heart attack or death. Apparently, also stroke has been associated with it. There are other more rare side effects, which I don't necessarily know how necessarily the mechanism fits in, but some people have reported breast tenderness and gynecomastia, that's swelling of the breast tissue. And then also, we don't recommend it in pregnant or nursing females because there are risks associated with it. And then a special consideration to take is when you apply minoxidil topically, you're getting effects directly where you apply it. When you take it by mouth, it just works everywhere. So you get hair growth pretty much everywhere, or you are at increased risk of getting hair growth everywhere. So if you're a female and you're taking it for hair growth on your scalp, be prepared. You may have some unwanted hair growth on your temples or even on your face. Another thing to consider is that this is a relatively new indication. Minoxidil for hair loss is a relatively new thing, and we don't necessarily know the correct dose. It's not even FDA approved, but a lot of things we prescribe in dermatology aren't even approved for that specific indication, but we still use it. But we don't know what the appropriate dose is for minoxidil, and it probably varies per person. It seems that we start somewhere between 0.625 to 2.5, and I've seen some people max out at 5, but most people stay at 2.5 milligrams or below. A good dosing that a lot of people recommend is 0.625 milligrams starting for females, and then 1.25 milligrams for males. Start on that for a couple months and then see how they respond and maybe go up on the dose. What do you guys think? Like, comment, follow for more. Tag me in a video you guys want me to do a reaction to. Otherwise, have a great day.